In this video, I would like to share with you some detailed footage of a patient who successfully recovered after experiencing a subarachnoid hemorrhage through the use of stem cell treatment. It's something I worry about every time, but I am concerned that videos about stem cells shouldn't be overly hyped or give people unrealistic expectations. Currently, whether in Korea or abroad, there are no approved stem cell treatments for cerebrovascular diseases. However, since legally permitted bone marrow or adipose stem cell procedures for cosmetic or anti-aging purposes often help improve symptoms of various conditions, patients with cerebrovascular diseases in Korea who have no suitable alternatives also consider these stem cell procedures, allowed for cosmetic or anti-aging purposes, as an option. This reflects the current situation in Korea. Even if stem cell procedures are performed for cerebrovascular diseases, it does not mean that dead brain cells or blood vessels in the brain will regenerate. As I mentioned before, I want to emphasize once again that stem cells help the body recover and regenerate itself, thereby contributing to maximizing the body's own healing and regenerative abilities. And I also want to mention in advance that the reason I am sharing this video is simply to provide information that stem cell procedures can sometimes have such effects in cases of cerebrovascular diseases. I would also like to sincerely and wholeheartedly thank the patient featured in today's video, as well as their supportive family, for allowing and helping us to share their case with all of you. In this video, I would like to introduce the case of a patient who began bone marrow-derived stem cell treatment within a month after suffering a subarachnoid hemorrhage and has shown remarkably rapid recovery through several rounds of treatment. He is a young man who suffered a subarachnoid hemorrhage while abroad. While he was hospitalized and receiving treatment at a local hospital, he developed inflammation in the brain. Although he could open his eyes and breathe, he was unable to make eye contact or move his limbs. After a difficult transfer from abroad to a major university hospital in Seoul, he underwent various tests but was told that there was nothing more they could do for him and that he should be transferred to a rehabilitation hospital. It was at this point that the patient's family contacted our hospital for further inquiry. I have repeatedly mentioned that when considering stem cell treatment for cerebrovascular diseases, there is no specific golden time for stem cells, but the global trend, and my personal opinion as well, is that the sooner the better. I explained this to the patient's guardian as well, and we decided that on the day the patient was discharged from the university hospital and transferred to the rehabilitation hospital, they would stop by our hospital to receive the stem cell procedure before being transferred to the rehabilitation hospital. We plan to administer the treatment about 3 times, once every 3 weeks. I explained that if there was potential for improvement, we would consider additional treatment. The next video shows the patient during the first treatment. Although the patient's eyes were open, they were unfocused and there was no movement in any of the limbs. A few days after the first treatment, the patient's right ankle started twitching as if having a spasm. Please take a look at the video recorded by the guardian. This is probably not the effect of the stem cells. What can be speculated is that as the stem cells enter the body, the growth factors secreted by the stem cells might be stimulating the nerve cells. In any case, I thought it was positive that some change had started to occur in a leg that previously showed no movement at all. If you watch the third video, you will see that after the third stem cell procedure, the patient is able to sit up alone and support themselves. From this point on, rehabilitation also began in earnest. The patient's mother said that every time they received treatment, she noticed new changes, which made her hope for more, so they decided to try a few more treatments. Personally, I believe that in young patients during the acute phase of stroke, multiple stem cell procedures are definitely much more helpful than the natural rate of recovery, so we decided to proceed with additional treatments at intervals of 3 to 4 weeks. After the 4th treatment, the patient began to walk on their own while holding onto a walker. Of course, many typical stroke patients also gradually recover over time, but in this case, I felt that the speed of recovery was much faster than usual. And since the degree of recovery in the early stages of a stroke is extremely important for overall recovery, I believe that maximizing early recovery ability through stem cell therapy can be a very meaningful treatment option when there are no other viable alternatives. About 3 months after starting stem cell therapy, with some support from the side, the patient was able to walk on their own, little by little. Of course, this can also be quite subjective, and since it was not verified by creating a control and comparison group, it may lack objectivity. However, based on my experience considering the patient's condition before starting treatment, I kept finding the results quite surprising. And from this point on, the patient started coming to the clinic in a regular car instead of an ambulance. With assistance, the patient was able to take the elevator and visit the hospital. The next video shows the patient walking in a rehabilitation hospital after 6 treatments. While the patient's strong will and dedication to rehabilitation were certainly important, this case once again reinforced my belief that stem cells can sometimes produce unexpected effects. I think this is a video that really makes you reflect deeply on that. Of course, I want to emphasize once again that not all patients experience such treatment effects. The final video was filmed in the operating room last month after the patient received treatment. Although cognitive ability and judgment are still lacking, it seems that the patient can understand speech through context, and their movements have also improved significantly. He even reached the point where he could give me a high five. Although it's still difficult, he's now able to walk on his own. While I'm curious about how much more he can improve in the future, I hope that with time he will recover even more, and that one day I'll be able to share a follow-up video with you all. In Korea, legally approved adult stem cells cannot revive dead nerve cells. However, the body itself makes tremendous efforts to compensate for the functions of already dead cells by the surrounding cells. I wanted to let you know that this stem cell procedure can help support such self-regeneration, rehabilitation, and functional recovery, which is why I decided to edit and share this video. Miracles or magical things may not happen right away, but if you think of stem cell treatment as fertilizing and cultivating a field, I personally believe that one day seeds will sprout, grow into trees, and eventually bear fruit. Even if the fruit is not entirely satisfying, I believe that trying stem cell procedures holds meaning in the hope that it will yield better results than simply standing by and watching. And one more point I want to emphasize is that if you are considering stem cell procedures, the sooner you receive treatment after the acute phase of cerebral hemorrhage or cerebral infarction, the better the therapeutic effect may be. I want to stress again that this is also a global trend in stem cell treatment for stroke. In my personal experience, if more than 6 months have passed, the improvement in symptoms seems to be limited. Within 1 month is the most ideal, but if 3 to 6 months or more than 6 months have passed, I believe the improvement in symptoms tends to be limited. If I recall cases where, after several months have passed in patients with cerebral hemorrhage or cerebral infarction, surgery is performed for other reasons, sometimes the brain becomes sticky and hardened like a thin rubber membrane. Such conditions can also negatively affect the regenerative action of stem cells. I believe it does have an effect. Please try moving your hand. Both hands. Right hand and left hand, both. Try doing jam jam. Open and close your hands. Jam jam. Jam jam. Try raising your hand. Give a fighting, cheer up gesture. Try doing the fighting gesture one more time. Now try moving your foot. Move your foot. Try wiggling it. Still can't understand the words yet. Please take a look at the bridge. Left leg. That's right. Left leg. This leg is correct, so please raise your hand. Is this hand not okay? Can you tell the difference? This hand is not okay. Hi, cheer up. I've been thinking a lot about whether or not to release this video. Because after watching this video, I was concerned that it might give people unrealistic expectations. And since stem cell therapy itself is an expensive treatment that isn't covered by insurance, changing the treatment, it was also because I was concerned that for those who might want the treatment but can't get it, they might not have known if they hadn't seen the video, but after watching it, they could feel a sense of alienation or other emotional issues. I ask for your understanding once again regarding this matter.